just joining us, lucky you that you can lie a little bit in this morning, but we're about to delve into a discussion which we know that many of you have your own feelings on, depending on which side of the fence you're on and what works for you. We're talking about the pros and cons of herbal medicine, and Dr. Perot, who's been a practitioner for many years. I was a little girl. That was a long time ago, right? Dr. Perot used to be our family physician. And Francis Morean, who is, do you call yourself a herbalist? I mean, is that what your official name would be? You're a herbalist or just...
A traditional healer.
A traditional healer, thank you very much, okay. So we have a medical practitioner in the very conventional sense of the word, and we have a traditional healer, which is a sort of alternative almost, or is viewed as an alternative. Dr. Perot, you've gone on record as having some very strong views, staunchly opposing sometimes the use of herbal medicines in treating disorders. Can you, give us a sense of why?
Yes, certainly, Joanne. I wanted to be made clear at the outset that I am not entirely and totally against herbalist medicine. I am against situations whereby, as I said in the article I wrote on it, that in the context of serious and potentially lethal illnesses, that herbalists have sometimes dissuaded my patients to adopt their line of treatment, very costly. I have on record 2 cases, which if I had the chance I could give a summary later as to why I'm peeved about that. I wanted to make it clear at the outset too that these cases were not Mr. Morean's case. It's only fair to him to let him know that at the outset. So that really is my peeve.
Okay. Mr. Morean, may I call you Francis? Because we tend to be very informal on the program, unless we're dealing with people in high office. You call yourself a traditional healer, or that's what you are. You say you're a traditional healer. What does that mean?
Well, essentially, I'm operating on the basis of traditional healing systems which have been used for generations in this country, in healthcare.
And that would encompass?
Well, mainly the use of herbs, but it may involve additional practices.
Such as?
Well, sometimes you may find that some practices use animal products, okay? Let's say shark oil, for instance, has traditionally been used in herbal medicines, incorporated into herbal medicines, okay? Of course, we have the products being sold on the market today from shark oil, extracted from shark oil. So it should be noted that all the traditional products, herbal products, or animal products even that have been used in traditional healing systems are now being brought to the fore in modern day medicine.
Well, let me throw something in here. Increasingly, what has come to the fore is that even many traditional doctors in a very traditional sense, medically trained, what have you, are looking at or are incorporating alternative, what can be construed to be alternative forms of treatment, etc., into their practices. But there's always the question of veracity, there's always a question of people in training and their really understanding of whatever their area is. How do you feel, Dr. Perot, about the, even from the very strict institutions that represent medical research and so, looking at the benefits of not just herbs and herbal medicines, but spirituality and concepts of faith and so in bringing about healing, particularly in terminally ill patients?
Yes, Susan, I would accept any line of therapy once that line, especially if it involves the use of therapeutics, once that line is subject to scientific scrutiny, by which I mean proper scientific double-blind trials. What we mean by a double-blind trial is where we give somebody a placebo, we give another group the thing on the trial, and then you scientifically measure the effect, and then you cross over, it's called a crossover trial, and any line of therapy which subject to a crossover trial proves to be of value will be acceptable to the medical profession. And that is the major problem we have about some of the alternative approaches.
What are your views, or what are your linkages? I mean, I was looking on the internet last night, and I mean, I could get so many hits in terms of looking at the whole area of alternative medicine and herbs and so. You should think, for example, the Chinese, who have a very long tradition of medicine that does not fit the concept of traditional Western medicine. A lot of the older civilizations and the Native Americans, the Amerindians, they all had their own sense of how they lived with nature and how they used what was in their environment to heal and to treat with diseases and illnesses, and it was all part of the culture. How closely annexed, if at all, is what you do to that kind of approach?
Well, it's tied into various aspects, actually, because in Trinidad we're very fortunate. We have the influence of the Chinese traditions, not to a large extent, but it's there. We have the influence of Africa, we have the influence of India, and we have the Amerindian culture still surviving in some parts of Arima where I'm based. And all those areas have been incorporated in my practice.
What are some of the things? I mean, for example, you know, when we're small growing up, you get ill and you have to go to the doctor. But if you were fortunate enough to have a grandmother or great-grandmother around, you get some kind of bush tea, you know. They would swear by their bush teas. When it was August holidays, you know, you have to get a good dose of Senapod or whatever it is. Of course, you could go to the drugstore and you could buy something over the counter. So there's always been that, would you agree there's always been that sort of coexistence of what is viewed as, you know, the trained medical perspective and the way of treating with things, and of course, what really used to be called old wives' or grandmothers' kitchen remedies?
Well, I can answer that, you can, because no, we don't have a problem against scientific inquiry. In London, 2 weeks ago, one of the 3,000-year-old traditional Chinese methods of treatment was found to be totally dangerous. And to put it in perspective, there have been many conventional Western medical therapies. Drugs have been thrown out, thalidomide and all these things. So all we are doing is having a search for the truth. But I must say that there are defects in both sides. But the point I'm still stressing is the Western medicine tries to analyze the defects in a scientific method and thereby try to arrive at conclusions which, in good faith, are believed to be accurate and scientific.
What is your response to that?
Okay, well, actually, the aspect of double-blind trials and so on, I mean, that is taking place in herbal medicine. Unfortunately, in Trinidad, most doctors have not made themselves privileged to looking for that sort of information. It's there, it's on the internet, it's in journals such as Herbal, for instance, which is published by the American Botanical Council. In fact, I actually brought along a book here for Dr. Perot called Herb Contraindications and Drug Interactions, because very often doctors tend to say, well, no studies have been done. In truth, in fact, many studies have been done. And this is just an example of some work that has been done looking at the interaction between herbs and drugs. And there's a couple others I brought here which are actually targeting the professionals, like Dr. Perot.
Okay, he's making a presentation.
Well, I don't deny that many studies have been done, but what I do say is many studies have been not done. That's my
well, actually, there are many reasons why many studies have not been done. Okay? First of all, the drug industry has driven the medical profession over the last 40, 50 years or so. Okay? And the demands of the drug industry have actually determined the principal reason why the drug industry has dominated the medical
practitioner respond to that the manufacture of drugs and the distribution of drugs is really pegged now to big business.
Well, that's entirely true. And I do admit, I know in Brazil, for example, Merck and a few of the big companies are spending a lot of time on research on the natural products in the Amazon area. But my point is, I don't think it's right to use anecdotal stories to introduce a drug into public use. This is my point. When I say a drug, even a treatment, a herbal treatment, in other words, those that have been totally authenticated by double-blind, I would support. What I do not support is I see thousands on the shelves, and I doubt whether they have been put to any trial of veracity.
Okay, I should say something here. Dr. Perot mentions that study in London on a Chinese system. I'm not sure the actual example he's speaking about. I'm not sure if that study was done actually in the system, in the traditional system as it has been done in China. Very often these studies are done outside of the system in which they're practiced. And very often when that happens, the actual results are quite different from when done by the traditional healers. Furthermore, I need to add that when you look at the increase in the use of herbal medicines over the past 10, 15 years or so, if there was a situation where the herbs are actually dangerous, one would have found an increase in the reporting of poisoning, toxicity, and so on from these herbs. And in America, for instance, where the use of herbal products have increased like over 50% within the last 10 years or so, there has not been, in fact, there has been a very insignificant increase in reporting of toxicity, even where the people who are using the herbal products are in mainstream North American culture and would normally report side effects to their physicians.
Okay,
that's just one point.
Okay, well, if you can hold your thoughts, we're going to have to take a break, and when we return, we continue our discussion with Francis Morean and Dr. Ivan Perot. We're talking about traditional Western medicine, coming up sometimes, it would seem, against traditional healing medicine. One being the way of the Western world, the other being probably the way of many civilizations that run very deep. And both gentlemen are exploring and discussing the pros and cons. We'll be right back. Now before 7 o'clock. We'll be taking some of your calls if you're interested in calling into the program, 6278232, 4106. Maybe you can tell us something about a treatment that you've had a good or bad experience with, and share your thoughts with our guests this morning, Dr. Ivan Perot and Francis Morean. We are talking about the whole area of research. Now we have a very, even in terms of Trinidad and Tobago and the Caribbean, we have a very rich tradition of herbs. I mean, all of us have grandmothers and great-grandmothers, as I said, who always could tell you about Christmas bush for fever, fever grass, senna, whatever it is. What I'm hearing from Dr. Perot, basically, is that he has no objection to these things, but it's the manner in which they're used. Is that it?
That's right. Yeah.
Or if there is not sufficient understanding. How do you respond to that, Francis?
Okay, well, putting aside the need for clinical trials, which in any case is not usually done on human beings. What needs to be pointed out is that we actually have a long history of use of these herbs that you've mentioned. And I mean, yesterday, for instance, I gave some awards to some of the traditional healers. We had a program at Holiday Inn, and most of these people are over 85 years old.
Are these the women that are a series of women that you've been?
Well, some are men, some are men, some, yeah. But most of these people are over 85 years old, and they're quite fit, mentally alert, right? And they're involved in their communities still. Now, if herbs are actually dangerous, as is often suggested, due to the absence of clinical studies and so on, then these people should be all dead, right?
Okay, we have a very first call on the line. We have Kuva on the line. Good morning, Kuva. Good morning.
Hi, morning, Joseph.
Morning.
Morning to you guys. I just want to share an experience that I have with respect to herbal medicine, and I want to thank the gentleman in the program who is pursuing the use of herbal medicine in Trinidad, because there's a red cherry the one with the fine seed that grows here in Trinidad. If ever I get up in the morning and my tonsils are inflamed, all I have to do is just to boil a few of the young leaves from that cherry tree, and I swear within 15 minutes everything is gone, and I could go through the day very good. So what Dr. Perot is saying, I mean, I totally disagree with him. It's only within the near future that we realize the importance of herbal medicine and the direction in which it's headed. I want to say thanks again to you guys.
Okay, thank you, caller from Cuba. Do we have another call on the line? We have St. James on the line. Good morning, St. James.
Yes, good morning, Josan.
Morning.
How are you doing?
Hi, thank
morning,
you.
Doctor, and morning, Mr. Morean. Doctor, I remember reading somewhere in a magazine that the drug Halcyon is not as good as it should be. When I say so, there are a lot of things like, a number of things. However, I see that many of our physicians, I have a relative here who is still being prescribed a halcyon, you know. I'm wondering what about that, you know. Thank you.
Yes, well, that's very easy to answer because we do admit that there are many, many outrageous defects even in Western or conventional therapy, and we've got to be on the alert. There is no perfect drug. There is absolutely no drug without a side effect. And the drugs in current usage have got to be constantly monitored. Sometimes there are controversies as to confirm whether these drugs are dangerous or not. But as I said, it's the search for the truth that continually goes on by scientific assessment of the practical uses of any drug. So you may find certain countries might ban a drug because they are more emphatic about the side effects. Others come to the conclusion that the good is more than the evil. But I would wish to stress that there is an inherent danger in any medication that you imbibe.
We have another call on the line. Baratari, good morning.
Good morning. I wanted to make a comment on this. It may be just considered another anecdote, but I think one of the reasons why people are turning to herbal medicine is because of the sort of cavalier attitude of some of our doctors. You know that Calypso, take 2 Panadol? That really describes the attitude of some of our doctors to their patients. Their absolute total reliance on what the chemist provides, and also the very unethical situation of some doctors' connection to certain chemists, so they are going to prescribe what is provided in that shop. My son has a problem as a result of allergies. It has created a terrible situation under the soles of his feet. I dealt with a medical profession for several years, and the condition, the prescription helped the condition to a certain extent, and it wasn't moving. I was persuaded, almost forced by my sister, to get some advice from Mr. Morean, and the condition has healed with the medication that he prescribed. So I want to thank him. I also wish that the medical profession would open their minds up to find the benefits of what these people are providing, because there are. So thanks, Mr. Morean.
Okay, this issue of the closed-mindedness almost sometimes, or the perception of closed-mindedness, Dr. Perot, and the fact that in other countries where, I mean, it's like most things that's driven by the market, that there is, even in the cosmetics industry, just to draw a similar kind of parallel, that the whole body shop concept is one that has really taken root in the fact that Anita, or whatever her name is, the lady who founded the body shop, has made it her life's work to go to places like Africa and South America and look at what the natural environment has and can provide in terms of the manufacture of cosmetics and so. And it's happening increasingly as well in the pharmaceutical world. The thing is, though, the big companies have the big bucks to set up the huge laboratories, and obviously in doing that they want to control the market. So isn't there something there that's telling us that even traditional Western medicine in that sense is recognizing that with all of the advancements we have made, we still have major kinds of diseases and so, which we have not really been able to cure in the strictest sense of the word, and that a lot of people are looking to alternative forms of medicine, notwithstanding coming from Western culture.
Right, I don't deny that at all. In fact, it's the right of anybody to seek any form of therapy. That's their constitutional right. What I would like is an answer to when Western medicine diagnoses a potentially seriously life-threatening ailment, and the herbalists advise them to withdraw medication, and these people die. And I have many instances. That is my problem. A skin rash, fine. Headache, fine. What about when you're moribund from cancer or something like that? Or you have a diagnostic problem that is surgically remediable by modern medical medicine. And that is what peeved me, and I wrote the letter. I have had 2 instances. One died, and another lady was rescued after 1 year of herbalism. And those are the 2 cases that I would like the herbalist to explain to me. What is your reaction when you hear that?
Well, I mean, people die using conventional medicine every day, but he wants you to respond.
These were salvageable.
Okay, I'd make 2 comments. First of all, doctors are not infallible. So even in terms of diagnosis, doctors could be quite wrong. In fact, a recent study done at Johns Hopkins University established that over 50% of the diagnoses done at Johns Hopkins are actually wrong. And they are the tops. Okay? So that's one point. The second point is that what Dr. Perot is saying essentially is that the clients were on medication and they were still seeking an alternative. So they were not satisfied. Right?
To their own detriment.
Fine. Well, I should say fine. What I mean is that they had a choice and they chose to go that way because they were not satisfied. What I'm saying is it is obvious that what is needed is a collaboration between the doctors and the herbalists. So that if a doctor is treating a patient and the patient wishes to look at the alternatives such as a herbal medicine, they don't have to be afraid to tell the doctor, well, doc, I want to go and see Mr. Morean, I want to go and see whoever, right? What would you advise me in the context of using herbal products? Because in every instance, in almost every instance where a patient wishes to consider using herbal medicines and is under medical care by a doctor, they are usually afraid to tell their doctors because the doctors essentially are usually antagonistic to herbal medicines. So what is needed is a change in the whole attitude of the medical profession towards herbal medicines so that the patient feels more comfortable in having a rapport with both their herbalist and their doctor.
Okay, you see that there could be more collaboration and peaceful coexistence.
Fine, so.
We have a caller from Arima on the line. Good morning, Arima.
Yes, good morning.
Morning.
3 years ago, I went to a herb doctor and for a bad cold. And he gave me some herbs to take, and yes, it really worked. But I questioned him on the cure of AIDS, and he said there is herbs that you can use to remedy that problem. I have a question for Mr. Francis. How true that is, and why not is not being advertised?
Well, I don't know who has the cure for AIDS. So that answers my question.
You know this point that Dr. Perot was making about, you know, the fact that if you had a rash or something like that, that he, you know, doesn't have too much difficulty with, but something that's more life-threatening. Do you all know the story of Lauren Hutton, the very famous movie actress out of the United States? She actually took a journey. She went to Africa with her family because she had a son, which by every definition, and I mean she's a woman with money and means, her son was said to be incurable, terminal. It was just a question of time. And they took it like basically a safari. And the whole documentary is about her experience with her children in Africa and her husband, doing all of the things, not just the thing of going to the medicine man, but becoming part and parcel of the whole cultural thing and understanding why things were done at a particular time. And her son is still alive today, and I mean, she's made a documentary on it, you know. And he was diagnosed by every top medical doctor that there is in the business because they have the means to do it. And they had said that, you know, he would not live. But there's another issue we want to raise, and that is, of course, to deal with cannabis. Marijuana is an illegal drug. Now again, in all civilizations, marijuana, just like any other herb, had its place in, you know, in whether it was in a religious or whatever ritual in the medicinal way, but of course it's illegal. What is your view on the use of marijuana?
Well, I think we've got to obey the laws of the country. Every country has legislation done in good faith. Legislation is a dynamic thing. It's constantly under review. There are some doctors who are appreciative of the medical benefits of marijuana, which I do accept myself. At the same time, I think that if the state has decided that for the better good of the community, at this point in time, that marijuana should be outlawed, we've got to respect the law. We can make recommendations pro or con anything. And it's the legality of it that I'm concerned about. And that is the point I was going to ask Mr. Morean. What gives him the legal right to diagnose and treat? Now, this is my big problem.
Okay, we have just 20 seconds here.
Okay, this answer would need more than 20 seconds, actually,
yeah,
because we're looking at the whole area of the Medical Board Act. And I'm not a lawyer, right? What I would suggest that is if the herbalists are contravening the Medical Board Act, it is up to the people who are responsible for upholding the law, take action.
Okay, well, I'm sorry that we're going to have to put a wrap on this morning, but I'd like to thank you both for coming in, and maybe we can continue the discussion another time. It's an open forum. Thank you both for coming in. Dr. Ivan Perot and Francis Morean. We take a short break, and when we return, it's the news update on the morning edition.